Hello, my dear students. I'm Dr. Vaishaly Bharambe. I've been teaching anatomy for the last 25 years and I love it. Today we are going to talk about scalp, arterial supply, venous drainage, nerve supply, lymphatic drainage and related anatomy. Before we go to my request, just understand that Scalp 1 is a lecture that has been taken. The link for it is given below. See Scalp 1. Orient yourself and come to Scalp 2. I will of course be introducing the topic a little bit today, just in case you have not seen the earlier lecture. Today's lecture involves a lot of drawings, so my request to all of you is sit with a packet of color pencils or drawing sheets or with any digital drawing implement. But request is please draw, students, when I ask you to draw. Remember, I have huge experience in teaching anatomy. Drawings help you to remember better. That's the bottom line. Alright, so when I ask you to draw, please do draw. Right, let's begin by trying to solve this MCQ. Which of the following is true of arterial supply of scalp? Supplied by branches of internal carotid, supplied by branches of external carotid, supplied by branches of vertebral artery, supplied by branches of both internal and external. Now I'm sure some of you know the answer, some of you don't. There are some other questions such as draw and label blood supply of scalp, draw and label nerve supply of scalp. For solving all of these, you have to have knowledge of scalp. You can't just have a general idea. You have to have knowledge. These are specific questions, right? So let's dive into this and get that knowledge, okay? In my earlier lecture, I have covered what is scalp, what are layers of scalp, what are the important layers, and I'm going to talk about the arterial supply, etc. in the present lecture. But before that, one revision of scalp to orient all of you. Okay, so here we goes. Okay, come on. This is the outer layer, S for scalp. Remember the mnemonic SCALP? Okay, so S for skin, C for connective tissue, A for aponeurosis, L for loose subaponeurotic tissue, and P for pericranium. These are the 5 layers, and now we'll talk about the arterial supply of scalp. Remember, arterial supply will be in which layer? It will be in the connective tissue layer where there is a dense network of blood vessels. But the arteries supplying scalp are basically 5 arteries. Okay? 3 are in front of your auricle, 2 are behind your auricle. Take a look. This artery is the supratrochlear artery somewhere here. Next is the supraorbital artery somewhere here. This is the superficial temporal. Just keep your hand on the side of your temporal region. I can feel my superficial temporal pulsating. Behind the ear is your posterior auricular artery and behind that the occipital artery. I have a question for all of you. Students, can you tell me the last 3 arteries which are written in black, they're all branches of which artery? Good, I'm glad you know this. They are branches of external carotid artery. And the supratrochlear and supraorbital are branches of internal carotid artery. So, understand. Scalp is a site of free anastomosis between branches of internal carotid and external carotid arteries. Let's now begin to draw this to understand this and make it into permanent memory. Alright, so get your color pencils and drawing books out and let's begin our diagram. Alright, dear students, let's begin by drawing the skull first. Okay, so draw this skull, draw the auricle on the side here, draw the nose in the front here. So you're kind of oriented. Alright, now pick up your red color pencils and begin to draw from anterior to posterior the first artery, the supratrochlear artery. Now lateral to it, draw the next artery, the supraorbital artery. In front of the ear, passing upwards and branching is your superficial temporal artery. Behind your ear, you have your posterior auricular artery, and behind that, you have the occipital artery. Remember, the artery number 3, 4 and 5 are branches of external carotid artery. Artery number 1 and 2 are branches of internal carotid artery. Easy enough? Alright, let's come back to the screen and continue our discussion. Alright students, now that we've understood the arterial supply of scalp, I want you to understand that scalp wounds bleed profusely. Why do they bleed profusely? Understand that the vessel wall is surrounded by dense connective tissue, layer number 2. The connective tissue blends with the adventitia of the blood vessel. Okay, so when the blood vessel is cut, it is unable to contract and close. It remains open, causing a lot of blood flow. That's one reason. There are two others. So anteriorly and posteriorly, you have your frontalis and occipitalis muscles. The moment there is an injury, the frontalis and occipitalis contract, pulling and keeping the blood vessel open, causing hemorrhage. Another reason is the dense anastomosis itself. So there is so dense an anastomosis that there is massive hemorrhage in scalp injuries. How do we halt bleeding? We compress the blood vessel against the underlying skull bone. What is the advantage of this? It helps in easier healing in case there is a massive avulsion injury to the scalp. Alright, this is an interesting image, isn't it? So this guy seems to have some kind of massive scalp injuries. There's a lot of bleeding going on. How do we stop it? Let's use our anatomical knowledge. Remember, all the blood vessels that came up to supply scalp came from below upwards. Remember, superficial, temporal, posterior, auricular, everybody has come from below upwards. So just take a tie and tie it up around the person's head, forehead, above the auricle, around the back. Tie it up. In fact, you can see a stick there. You can put a pen through the tie and just keep on rotating it and tightening it. This will compress every artery there is. Okay? Quick and very smart stoppage of hemorrhage from the scalp. Alright, I hope you liked this explanation. Let's take it forward. Let's talk about the venous drainage. What goes into the scalp has to go back to the heart again. Remember, if there are 5 arteries on each side, there are the same named veins there as well. So if I had supratrochlear, supraorbital here, there will be veins of the same name. Superficial temporal, vein. Posterior auricular, vein. Occipital artery, so occipital vein. So 5 veins. But we are going to understand the venous network of this in a different way. We're going to draw it. But first, come to the screen and understand where all these veins are placed and what is this fantastic venous network that gets formed in the head neck region. Okay, so come here. Let's see the supraorbital and supratrochlear veins uniting to form the angular vein along the medial angle of your eye. This runs across the face in the form of a facial vein. Here you are seeing the superficial temporal vein, which meets the maxillary vein. Remember, just keep on following the mnemonics and the animation and the number. Okay, so this superficial temporal and maxillary vein unite to form the retromandibular vein. The anterior division of retromandibular vein meets the facial vein to form the common facial vein that drains into the internal jugular vein. This is how your anterior part of your scalp drains through the venous network into the face, into your internal jugular vein. Let's go to the back. How does the back get drained? Right. So here you are seeing the posterior auricular vein meeting with the posterior division of retromandibular vein to form the external jugular vein. Remember the vein that crosses superficial to the sternocleidomastoid? It enters into the posterior triangle to finally drain into the subclavian vein. Okay. There's also an occipital vein which drains into suboccipital venous plexus. And now those veins which cause so many problems, the emissary veins. So there are 2 sets of emissary veins we see in scalp. One is the parietal, which connects the scalp veins to the superior sagittal sinus, and the mastoid emissary veins which join it to the sigmoid sinus. Of course, we must not forget the diploic veins. So this entire thing is the venous drainage of scalp. I want you to draw this with me to understand it and make it into permanent memory. Okay? Come on students, it's not difficult at all. Come on, let's draw. Okay? Remember, I want you to enjoy the process of drawing. Don't just draw because I am telling you to draw. Draw because it's fun. When you enjoy and do something, the chances of your having a better recall are way higher. So, all right, should we draw? Come on. So, all right, dear students, we're going to start by drawing a face. It's okay if it is not a perfect face, fine, just draw it. Okay, so here is your forehead, nose, the lips, the chin. Here is your scalp, okay, and that's your neck. Understand that coming from above is your supratrochlear vein, meeting with the supraorbital vein to form the angular vein. The angular vein now begins to descend backwards across the face as the facial vein. Okay. Meanwhile, the superficial temporal vein meets with the maxillary vein to form the retromandibular vein. The retromandibular gives rise to an anterior division which meets with the facial vein to form the common facial vein, which drains into the internal jugular vein. Parallelly on the posterior side, the posterior auricular vein meets with the posterior division of retromandibular vein to form the external jugular vein. The external jugular vein crosses superficial to the sternocleidomastoid and finally drains blood into the subclavian vein. Okay. Meanwhile, you have occipital veins draining into suboccipital venous sinus. You've got emissary veins and you've got diploic veins which we cannot draw. So this here is the basic network of venous drainage of the face also, surprisingly. You have supraorbital, supratrochlear veins, angular vein, facial vein. Okay. You've got superficial temporal meeting maxillary. All right, you've got posterior auricular. All these, if you are able to practice this diagram a couple of times, you will never have problem talking about venous drainage of scalp and even the venous drainage of face. I hope you have got this. Come back to the screen, dear students. Right. So remember, students, emissary veins are valveless veins. So they can cause spread of infection from superficial scalp infection into the underlying bone, causing osteomyelitis. They can cause it to go into the intracranial veins, causing venous sinus thrombosis. So in venous drainage, it's important that you remember the job of emissary veins, which is valveless and spreading infection from upwards down into the bone or into the brain, causing venous sinus thrombosis. Let's now come to the nerve supply of scalp. Okay. The scalp is supplied by 10 nerves. 5 nerves in front of auricle, 5 nerves behind the auricle. Out of these 5, can you see something peculiar in this diagram, students? Yes, some nerves are yellow and the others are a much darker shade. Why is that so? Because on each side there are 4 which are sensory nerves and 1 which is a motor nerve. Out of every 5 in front of auricle, 4 sensory, 1 motor. Okay. So the nerves are as follows: supratrochlear, supraorbital, zygomatico-temporal, auriculotemporal. Behind the ear, greater auricular, lesser occipital, greater occipital and third occipital. All sensory nerves. Now here you see the temporal branch of facial and the posterior auricular branch of facial. Does this strike you something familiar? Yes, these are the nerves which supply the frontal belly and the occipital belly of occipitofrontalis muscle of scalp. Okay, so now let's go back to our drawing sheet and draw this nerve supply. Okay, come on, get your color pencils out and let's draw. All right, dear students, are you ready? First thing, as usual, we are going to draw a section of the scalp. On the side, I'm going to draw the auricle. In front, I'm going to draw the nose. Okay. Now let's remember one thing. 5 nerves in front of the auricle, 5 nerves behind the auricle. Out of that, 4 are sensory, 1 is motor. Get your concepts clear. Okay. Now let's draw the nerves. Coming from fore anterior backwards, supratrochlear, supraorbital. On the side, zygomaticotemporal near the ear, auriculotemporal. I have not drawn which nerve? I have not drawn the motor nerve. Okay. Again, behind the auricle, you have great auricular, lesser occipital, greater occipital, third occipital. What should we draw now? Let's now draw the motor branches. Here is the temporal branch of facial. Here is the posterior auricular branch of facial. So, one motor, four sensory in front and one motor, four sensory behind. Very easy. You only have to use logic to remember the names. Remember that the nerves at the back are all coming from the cervical plexus. Nerves in the front are branches of trigeminal, either ophthalmic division of trigeminal or the maxillary-mandibular division of trigeminal. Okay. All right. Let's come back to the screen now, students. Right. Let's now talk about anesthesia. Why are we interested in nerves? Usually if there is an injury, I need to give anesthesia. That is what it's all about, isn't it? Anesthesia to the scalp is a bit of a problem. Why? Why is it difficult? It is difficult because, again, we come to the anatomy. The connective tissue network is so dense in the layer where the nerves are spread out that when you inject an anesthetic, it is not able to spread well. So the nerves often remain unanesthetized because the anesthetic has not reached there. So what shall we do? Another problem is there is an overlap of dermatomes of the trigeminal. Remember I told you trigeminal and the cervical branches. So again there is a problem. So many people advise general anesthesia, but most of the time in good knowledge of the nerves will help you to give a proper local anesthesia and go ahead with your job. But you must remember that density of the connective tissue must be taken into consideration when you are preparing to give anesthetic for any procedure on the scalp. Let's now come to the last part of this class, which is lymphatic drainage. As you can see here, the anterior part of the scalp drains into pre-auricular lymph nodes. The posterior part of the scalp goes to occipital lymph nodes and to the post-auricular lymph nodes. Okay, so either the lymph nodes are in front of your ear or behind the ear or low down here. Okay. Now, the importance of knowing this is that sometimes the patients will come to you saying there is some thickening here. The possibility that there is an infection of scalp and that is why the lymph nodes are swollen. Same can be true for even people who have head lice. Okay, so these lice also cause some kind of low level infection which causes the lymph nodes to swell up. Okay. With this, we've completed the arterial supply, venous drainage, nerve supply and lymphatic drainage of scalp. Let's see if we can solve these MCQs. I want you to attend to all these MCQs. If you are unable to attempt some of them, please give me a call or write it in the comment section. I'll do my best to ensure that you get the answers or help you to solve the MCQs. Okay? Alright, dear students, this completes the lecture on scalp. I want all of you to go back to Scalp 1. The link is given. Take a look at that. Scalp 1 and then today's Scalp 2 will actually help you to complete the topic of scalp. Alright? Please attend it, understand it, solve MCQs. I'll be soon putting up MCQs on my website also. Please go and practice MCQ solving there. Feel free to contact me whenever you have problems. I'll try and help you to solve all of them. So it was a great pleasure being here, taking this wonderful class with you. I'll see you across the screen in some other video. Thank you so much, students.